individuals with oppositional disorder exhibit characteristics such as being hostile, they're argumentative, vindictive, and angry. These individuals display many negative behaviors. They include blaming others for their mistakes, intentionally annoying other people. They have a tendency to throw temper tantrums, refuse to comply with requests or rules. And we'll discuss more of those negative behaviors later in the presentation. Symptoms of ODD include angry and irritable mood. And this is displayed when they have a loss of temper. They display a touchy mood. Because of this touchy mood, they can be easily annoyed. They also display anger and bitterness. Another symptom associated with ODD is argumentative and defiant behavior, and this really is what defines ODD. Individuals with ODD have a tendency to argue with authority figures. They are actively defying or refuse to comply with rules or requests from authority figures. They also deliberately try to annoy other people around them just to get them riled up and then get them upset. They also have a tendency to blame others for their mistakes and misbehaviors. Another aspect of ODD is vindictiveness, and this is displayed when an individual is trying to seek out revenge and they have a spiteful attitude. Some negative behaviors that are associated with ODD include frequent temper tantrums. And it is common when children are young and they're tired and frustrated and stressed out to have a temper tantrum and act out. However, individuals with ODD display these symptoms consistently and frequently, and these symptoms are so severe within these individuals that it actually interferes with their day-to-day functioning. Some other negative behaviors include excessive arguing. They have a tendency to question the rules constantly. They are actively defying other people. They refuse to comply with adult requests. And they are intentionally trying to annoy the other people around them just to make those people upset. They also blame others for their mistakes and misbehavior. They have a tendency to have a touchy mood and can be easily annoyed. And also when they are upset, they can be mean and hateful with their talking. And lastly, they can display spiteful attitude and attempt to seek revenge.
Cultural and gender aspects of ODD can influence how and who is labeled with it. There have been many studies that show that maybe the type of environment we raise our children in could influence ODD symptoms and the way we diagnose boys compared to girls. Looking at ODD culturally, these baseline items can influence the high incidences of symptoms connected to ODD. They affect mostly children that come from an ethnic minority background in a developed or undeveloped country. They have a negative home environment. They have high neighborhood crime rates that create stress, poor prenatal care, poor infant nutrition. All these things could decide whether or not your child could have higher symptoms of ODD, no matter what your culture is. There was a study conducted with Puerto Rican children. One group lived in Puerto Rico and the other group lived in the Bronx. The results showed that even though both areas are significantly different, the culture of the Puerto Ricans helped to keep the incidences of ODD low. The main reason for this success was due to the positive and protective factors in this particular culture. This is to show that even if a child is brought up in a poor environment, they may still be successful as long as there is a positive family atmosphere. Now we will look at the comparison of the American culture and the Asian culture concerning ODD. Each culture has its own norms of what is and is not acceptable of their children. In the Asian culture, some normal behaviors are suppression of aggression, anger and strong emotion, and internalized behavior. American culture accepts showing more emotions openly and supporting externalizing behaviors. The final results of this cross-cultural study has shown that no matter what culture you belong to, the prevalence of ODD is similar compared to other cultures when using the DSM-3 revised or DSM-4. We will now look at how gender differences influence who is being diagnosed with ODD. Studies have shown boys are far more likely to be diagnosed with ODD than girls. The reason for this could be the different ways that boys and girls display their behavior. Boys with ODD display their behaviors by being more aggressive, having more external behaviors, and showing more oppositional actions such as poking people, making fun of people, and fighting. All these things are more visible and are easier to document and identify. Girls, on the other hand, show their behavior differently. They have more anxiety, they refuse to talk to people, they can be more malicious than others, they avoid being blamed, and they have more internal behaviors. These type of behaviors are a little more subtle and will need someone to really look at and pay attention to how these girls behave. This is a table showing the prevalence of ODD when it's concerning the boys and the girls. Symptoms such as loses temper, argues, defies, annoys, accuses others, touchy or easily annoyed, angry, resentful, vindictive. This table shows that the boys use more external behavior and the girls use more internal behavior when it concerns ODD. Results of the study show that the boys will be easier to identify than the girls due to the way they display their behaviors.
In order to diagnose a child or an adolescent with oppositional defiant disorder, up until the last few months, we have used the Diagnostic and Statistical Manual of Mental Disorders, 4th edition, or the DSM-4. In the past, these children or adolescents needed to meet 4 of the 9 criteria set to work towards a diagnosis of ODD. With the addition of the Diagnostic and Statistical Manual of Mental Disorders, 5th edition, or the DSM-5, newly released in 2013, with the new edition of the DSM-5, children and adolescents must meet criteria of 4 of the 8 criteria set. While leaving the DSM-4 behind and beginning with the DSM-5, both books require a child or adolescent to show signs of oppositional defiant disorder for 6 months. Both DSMs must meet 4 of the criteria listed. While looking at our new book, the DSM-5, the criteria are as follows. Angry or irritable mood, 1, often loses temper. 2, is often touchy or easily annoyed. 3, is often angry and resentful. In our next subsection of the DSM-5, argumentative and defiant behavior. Number 4, often argues with authority figures or, for children and adolescents, with adults. And number 5, often actively defies or refuses to comply with requests from authority figures or with rules. Continuing with our argumentative and defiant behavior, 6, often deliberately annoys others, and 7, often blames others for his or her mistakes or misbehaviors. Rounding off our subsection of the DSM-5 is vindictiveness. Number 8, has been spiteful or vindictive at least twice within the past 6 months. To me, the vindictiveness really sets apart from all the other subtitles from the DSM-5. To be diagnosed with a condition of ODD, oppositional defiant disorder, before final diagnosis can be made, other conditions need to be ruled out from that diagnosis. Many times children or adolescents are feeding off other individuals or it's natural behaviors of these children. So you cannot necessarily say that these behaviors are that of ODD, but just how the child may act. Another factor that must be ruled out is ADHD, attention deficit hyperactivity disorder, anxiety, depression, and child abuse or sexual abuse and neglect of the child. All areas need to be investigated and ruled out before a final diagnosis of ODD may or could happen.
The International Classification of Diseases 10th revision differs from the DSM-4-TR with respect to its treatment of ODD. The ICD-10 says that ODD is a mild variant of conduct disorder. ODD is a subtype of conduct disorder rather than a specific diagnosis. As it pertains to DSM-4-TR, in matter of ODD, in some cases a clinical diagnosis of ODD is not permitted. With the DSM-4-TR, it allows for a comorbid diagnosis but no ODD diagnosis after age 18. The current diagnostic criteria for DSM-4-TR have internal consistency and good predictive and negative predictive value. The treatment of ODD alone is very limited, as the diagnosis of ODD is most likely to occur with another behavioral problem. Usually occurs with a comorbid diagnosis of attention deficit hyperactivity disorder, ADHD, or conduct disorder. Without comorbid disorders, psychotherapy is generally implemented. If psychotherapy fails, psychostimulants or atomoxetine is used. Long-acting medications are generally recommended. Currently, there are no studies that examine drug therapy treatment for ODD alone. Many researchers believe family involvement in the treatment of children and adolescents with ODD is a great determining factor of patient success. Family intervention has been seen as the key to effective treatment. There has been research that shows there's a reduction in negative behaviors. Family intervention includes parent management training and social problem-solving skills training as well. A 2-year case-control study that measured the effects of family intervention on 158 young adolescents that had not been formally diagnosed with ADD found a great reduction in scores. With parent-only, teen-only, and parent-teen behavioral interventions, there is an average of 30% reduction in scores. Mental health outpatient services that utilize family intervention and drug treatment seem to be most effective. However, funding for these programs is difficult to secure. Since ODD is most likely to be diagnosed comorbidly, many studies gauge the effectiveness of treatment with ODD and an additional behavioral problem. ODD is most likely to be diagnosed comorbidly. ADHD is the most common comorbid diagnosis. ADHD medications have a positive effect on ODD symptoms. Most children with ODD have several other mental health disorders which make treatment more challenging. Drug therapy is usually the first line of treatment with a comorbid diagnosis of ODD. Drug treatment in combination with psychotherapy has proven to be most effective. Psychostimulants are the most commonly prescribed medication. Patients diagnosed with ODD and an additional behavioral problem are usually prescribed longer-acting psychostimulants, since longer-acting psychostimulants are more effective than short-acting medications because of higher remission and compliance rates. There are various types of drugs used in treatment of ODD with a comorbid diagnosis. Psychostimulants are the most commonly prescribed. They're very well tolerated and highly effective. These drugs work to decrease the tendency to interrupt, fidget, and finger tap and increase on-task behaviors. Examples of psychostimulants include Adderall XR, Concerta, and Ritalin LA. Atomoxetine is a specific noradrenaline transporter inhibitor. It is a non-stimulant medication and it is not a controlled substance. One of the major advantages of atomoxetine compared with other ADHD medications is it has a long duration effect which usually can last as long as 24 hours. Antidepressants are prescribed when psychostimulants and atomoxetine have not been effective. One possible side effect with psychostimulants is the possibility of developing tics and/or Tourette syndrome. Antidepressants are used for clients that have developed tics and/or Tourette syndrome. Most antidepressants focus on the treatment of ADHD, not specifically ODD. Alpha-2 agonists are second-line medications in the treatment of ODD comorbid diagnosis. Examples include clonidine and guanfacine. Patients generally receiving clonidine or guanfacine include those diagnosed with ADHD and conduct disorder, patients with ADHD and severe ODD, ADHD patients with tics or Tourette syndrome, and patients with ADHD and ODD who do not respond to treatment with psychostimulants and atomoxetine. When there is a comorbid diagnosis of a mood disorder, such as bipolar disorder, mood stabilizers are used. Examples of mood stabilizers include lithium, carbamazepine, and valproate. In patients with mood disorders, ODD and ADHD, mood regulators may have a role in treatment. ODD symptoms may improve with the effective treatment of the mood disorder and the ADHD. Because there is such a close link between ODD and aggressive behavior and ODD and conduct disorder, oftentimes antipsychotics are used. Antipsychotics are used when the patient is not responsive to psychostimulants. They are used to treat aggressive and oppositional behaviors that do not respond to other medications. Examples of antipsychotics that are used with comorbid diagnosis including ODD is risperidone, or sometimes known as risperidol.